It's amazing to see the greater amount of transparency that so many providers have been showing on social media. For instance, Julie Kaplain shared her personal vascular occlusion experience which inspired her to work so hard to bring awareness to our community. She then later shared some of her own experience with injecting dermal fillers and having a vascular occlusion. This took our community by storm, and so many injectors stepped up to share their own experiences. Just the other day, I saw a post from a newer injector. It had photos of a video of a patient's lower lip showing a significant bruise and delayed capillary refill. She was asking if this was a vascular occlusion. Although in a perfect world, a less experienced provider would be working in a presence of a team to support them. Thank goodness for a community like our online community where so many providers jumped in and gave her the feedback that this indeed looks like a vascular occlusion, and they recommended reversing. Really understanding where these vessels typically lie and what tissues can be affected can help guide a provider in making a better clinical judgment. Today, I'm going to discuss some of the major arteries in our face, where they are going, and what tissue they are supplying oxygen to. There are two facial branches of the facial artery, the cervical branch and the facial branch. The main vessels of the cervical branch are the ascending palatine artery, tonsillar branch, submental artery, and glandular branches. The ascending palatine artery supplies the palatine tonsil, soft palate, elevator valve palatine, and auditory tube. The tonsillar artery also supplies the palatine tonsil, in addition to the root of the tongue. The glandular artery supplies the submandibular gland, muscles, lymph glands, and skin. With reference to facial vascularity, it's important to note that the submental artery is the artery that runs under the jawline and then up on either side of the chin. This artery supplies the mylohyoid branch of the inferior alveolar artery. It also supplies surrounding muscles and skin in the submental area. Now that there are multiple fillers with on-label indications for chin augmentation, it's becoming more frequent to see vascular occlusions here. When assessing for vascular occlusion, it's important to look under the tongue because the submental artery also anastomoses with the sublingual artery. Typically, when using a needle, closer to the center is considered safer because more often than not, the submental artery runs more lateral. The main vessels that arise from the facial artery are the inferior labial artery, superior labial artery, lateral nasal branch to the nasalis, and the angular artery. I'll show you here. Here's the facial artery, and then the inferior labial artery would come down here, and then we have the superior labial artery here. Then it turns into the angular artery, and then we have the lateral nasal branch. The facial branch of the facial artery branches from the external carotid artery and runs under the platysma. The facial artery enters the face along the jawline at the level of the antegonial notch, which is a little divot just below the masseter and the DAO. With light pressure, a pulse can be palpated here. So it would be right here where the facial artery comes in. The facial artery is tortuous to accommodate for the movement where the facial vein is straighter. It goes across the lower cheek under the zygomatic major, often running near the marionette line. So it comes over here. Then becomes more superficial near the lower nasolabial fold. So injecting here should be done with caution. It then branches off to the inferior and superior labial arteries. At the level of the lip, the labial arteries penetrate the bicularis oris and typically sit deep at the wet-dry border of the lip, and therefore superficial injections are generally safer than deeper ones in this area. The superior labial artery supplies the superior labial glands, tissue, and muscles, and has an alar branch which supplies the ala, and has a septal or columellar branch which supplies the nasal septum. I have seen an occlusion here where this branch was large and ran quite superficially, right by where the Cupid's bow was. When I scanned this occlusion, the patient's mother was there, and she told me she had an occlusion in the exact same area some time back. Both of those occlusions resolved with no sequelae. The inferior labial artery supplies the inferior labial glands, mucous membrane, and surrounding tissues. The facial artery runs lateral to the lip, where it branches to that inferior and superior labial artery. Once the superior labial artery has branched off, it then becomes the angular artery. Then it branches branches to the lateral nasal artery, which supplies the dorsum of the ala of the nose in here. It anastomoses with the other side of the lateral nasal artery. Sometimes this branch comes from the superior labial artery. There are lots of anatomical variations that can occur. There's also potential for vascular occlusion lateral to the ala of the nose from an external vessel pressure phenomenon from piriform injections. Another place that can have external pressure phenomenon is the nasal tip and the glabellar region. The nose or glabellar region is an area of rich anastomoses of the internal and external carotid and has highest potential for blindness. But cases are probably underreported, and that number is probably much higher than what we already know. The angular artery supplies the lacrimal sac and the orbicularis oculi muscle and surrounding tissue in here. Occlusion here can cause significant problems if it's not cleared quickly. As mentioned earlier, I have seen an occlusion here that has affected tissue from below the lip all the way up into the forehead. And there have been cases of blindness from injections in this piriform space, just as there has been in almost every area of the face. Filler injections on the bone is considered safer here, although there are some cases where anatomical variants have placed this artery at the level of the bone. There is a separate blood supply for the lateral aspect of the face. In the temple, there are two deep temporal arteries in here. The deep temporal arteries arise from the maxillary artery, one of the two terminal branches of the external carotid artery. It consists of an anterior and posterior artery. They ascend between the temporalis muscle and pericranium. It anastomoses with the middle temporal artery and lacrimal artery. The deep temporal arteries supplies the temporalis muscle. The middle temporal artery is a proximal branch of the superficial temporal artery that originates below the zygomatic arch. The maxillary artery is one terminal branch of the external carotid artery, and the superficial temporal artery is the other. The superficial temporal artery has a frontal branch which runs more anterior and a parietal branch which runs more posterior. They are located in the superficial temporal fossa. Branch of the temporal artery goes towards the supraorbital and supratrochlear artery and commonly anastomoses with these, which are part of the internal carotid system. And to reiterate, filler can backflow to the ophthalmic artery from here into the central retinal artery, which can cause permanent vision loss. The superficial temporal artery supplies the temporalis muscle and the scalp. The transverse facial artery branches from the superficial temporal artery and runs across the inferior border of the zygoma, right across here. It continues through the parotid gland, runs alongside of the face, and divides into many branches. The superficial branch supplying the superficial lateral cheek, and the deep branch supplying the parotid gland, duct, and part of the masseter. It anastomoses with other areas of the face, such as the facial artery and infraorbital artery. This content doesn't cover the arteries that arise from some of our facial foramens. That will be covered in another segment. As discussed before, arteries often anastomose with other arteries. So many of the arteries mentioned anastomose with the arteries that arise from the foramens, such as the mental and infraorbital arteries. If this content brought you value, please like and subscribe. If you would like me to cover something in more detail, please let me know in your comments below.